Custom foot orthotics for low back pain. Chiropractors and others prescribe orthotics for either lower extremity complaints or for low back pain. The choice has become increasingly complicated by improvements in weight-bearing analysis and the ease of fabrication from the data obtained, and the number of providers with similar products. And there still remains the question of whether these are an effective approach for low back pain. There is also the continuing debate over whether to cast from a non-weight-bearing impression in the neutral subtalar position or fabricate from a full weight-bearing analysis. The general approach used by those who subscribe to the biomechanical compensatory effects of non-weight-bearing orthotics for foot and lower extremity disorders is to use the less rigid weight-bearing approaches for low back pain, assuming that it is the cushioning effect rather than the compensatory effect of improving foot and ankle biomechanics. Surveys indicate that approximately 72.1% of chiropractors combine spinal manipulation with shoe orthotics for the treatment of low back pain. It would seem appropriate, then, to determine their effect alone or in combination with chiropractic management. A new study attempts that. It's entitled Shoe Orthotics for the Treatment of Chronic Low Back Pain, a randomized controlled trial published in the Archives of Physical Medicine and Rehabilitation in 2017. It should be made clear that these are foot leveler orthotics. The study, in fact, was funded by foot levelers. This leaves both a positive and negative impression. Some might accuse foot levelers of feathering their own nest, assuming positive results, while others would applaud them for accepting the results of the study regardless of whether they are supportive or not for their product. Given there is no way to know the results in advance, they should be applauded. According to the researchers, the purpose of this study was to, quote, determine the change in perceived pain levels and functional health status in patients with chronic low back pain at the end of 6 weeks of orthotic treatment alone, the orthotic group, or orthotics plus chiropractic treatment, the plus group, as compared to no treatment or the waitlist group, unquote. All subjects were given an orthotic assessment, including a standing static evaluation of posture and foot pressure mapping using the BodyView Imaging Unit from foot levelers. Images of the bottom of the foot were quantified based on a color replacement algorithm, which was used to calculate various angles and indexes of foot contour. At the randomization visit, a clinician or intern discussed the procedures for proper use of orthotics with those in the orthotics or plus groups and reminded those in the waitlist group that she or he would receive orthotics at the week 6 visit. 75 of the 225 participating subjects were randomized into the orthotics group. They received 2 pairs of custom-made leather shoe orthotics, the moderate luxury full-length and the tight-fitting luxury 3/4 length dress model, containing supports for the medial longitudinal, lateral longitudinal, and the anterior transverse arches. Instructions to the participants regarding the break-in period were that the break-in period was approximately 2 to 3 weeks. Participants were instructed to gradually increase the amount of time that the orthotics are worn and that there may be a slight increase or change in symptoms while the body adapted to the orthotics. 75 subjects were randomized into the plus group. All were given 2 pairs of orthotics. Manipulation was generally high velocity, low amplitude of any region of the spine, or flexion traction with adjunctive care allowed. Plus group subjects were asked to complete 1 to 4 visits per week for each of the 6 weeks of chiropractic care for a range of 6 to 24 visits total. The wait and see group were randomized to a 6-week waiting period, after which they were also given the same 2 pairs of custom-made orthotics, so that at the long-term follow-up, all participants had received orthotics. This is important when we look at the long-term follow-up pain scores. Outcome measures included average low back pain level measured by the numeric pain rating scale and low back disability measured by the Oswestry Disability Index. Scores were collected at baseline, 6 weeks, 12 weeks, and after an additional 3 months, 6 months, and 12 months. This long-term follow-up is one of the strengths of this study. Researchers also measured compliance to care and the use of the orthotics. Compliance was defined as at least 1 chiropractic treatment per week for 6 weeks in the plus group and at least 8 days of orthotic wear time every 2 weeks post-break-in period for the orthotic and plus groups. No participant was excluded for noncompliance. In the plus group, 86.7% of participants were compliant with chiropractic care and 96.8% were compliant with orthotic use. In the orthotic group, 92.5% were compliant with orthotic use. Let's look at how groups improved. After 6 weeks, average low back pain decreased in all 3 groups, demonstrating less than 1 point improvement in the control group, yet 1.9 and 2.3 point improvements in the orthotics and plus groups respectively. Pain decreased from baseline in all 3 groups for all time points out to 12 months. But by how much? Let's look at baseline pain scores and improvements at different time points. At baseline, notice that for all 3 groups, the pain levels were pretty similar, 5.6 for the weightless group, 5.5 for the orthotics group, and 5.7 for the plus group. Now let's move 6 weeks out and look at the change. For the weightless group, it was only 0.7, for orthotics, 1.9, and for the plus, 2.3. But notice what happens at the 6-week time frame when the weightless group is given orthotics. Measured now at 12 weeks change, we see that the change is equal for all 3 groups, with the weightless at 2.2, the orthotic group at 2.4, and the plus group at 2.5. Now, what happened to all participants regardless of initial treatment? Well, at 12 months follow-up, pain remained at a level of approximately 3 on the NRS in all 3 groups. That was 3.5 for the weightless group, 2.8 for the orthotics, and 3 for the plus group. For all of these mean scores, note that the range of plus and minus was always wide, somewhere between 1.9 to 2.5, or at 1 year equal to the actual pain score itself, which means in some cases patients improved, and in others they did not. So what are those percentages? The best results were in the orthotics plus group, where 70% had a decrease in pain and 56% a decrease in disability of 30% or more compared to baseline. For the orthotics group, it was 58% improvement in pain and 38% improvement in disability, and for the weightless group, 22% improvement in pain and 20% improvement in disability. Notice what happens when you use percentages versus actual scores and changes in scores. Note also that the researchers state that scores were not significantly different between the orthotics and plus groups. So what did the researchers conclude given these findings? Quote, 6 weeks of prescription shoe orthotics significantly improved back pain and dysfunction compared to no treatment. The addition of chiropractic care led to higher improvements in function, unquote. So what are some implications? If you recall, the group evened out at 12 weeks after the weightless group received their orthotics at 6 weeks. What should be noted then is that the common thread for improvement was in fact the orthotics. So prior to this study, what does previous research indicate? There have been several reviews specific to this topic. Although single studies demonstrate mild improvement, there's no indication of a significant clinical effect. In BMC musculoskeletal disorders in 2014, a systematic review and meta-analysis was performed. The title was The Effectiveness of Shoe Insoles for the Prevention and Treatment of Low Back Pain. They conclude, quote, there is insufficient evidence to support the use of insoles or foot orthoses as either a treatment for low back pain or in the prevention of low back pain, unquote. In the Journal of Manipulative and Physiological Therapeutics in 2013, a study titled Effect of Customized Foot Orthotics in Addition to Usual Care for the Management of Chronic Low Back Pain Following Work-Related Low Back Injury was published. The researchers conclude, quote, the findings show that patients in this study with chronic nonspecific low back pain following work-related low back injury had greater improvement in short-term outcomes with orthotics and usual care than with usual care alone, unquote. The usual care group were given a 6-week exercise therapy program along with prescription analgesics. The orthotics group received the usual care approach plus orthotics. And also in JMPT, a study was published entitled Influence of Foot Orthotics Upon Duration of Effects of Spinal Manipulation in Chronic Back Pain Patients, a randomized clinical trial. The researchers conclude, quote, both groups improved with chiropractic care, including spinal manipulation. However, there was no statistical difference shown between sham and custom orthotic groups, unquote. So what does all this mean when taken together? The results of this study suggest that individuals with chronic low back pain still have some pain a year later regardless of whether they use orthotics or orthotics plus chiropractic care. It should also be noted that the p-values for between-group differences did not always meet the standard threshold, so the strength of conclusions between groups is not as strong as we would like it to be. The short-term benefits of combined care might warrant a therapeutic trial, knowing, though, that the advantage will diminish over time. Certainly based on the results of this study, a higher percentage of those using both orthotics and chiropractic care will have a clinically significant result in 6 weeks, although not very different than without chiropractic care over time. The improvement with orthotic use seems as effective as chiropractic care and orthotics, which would then beg the question, why use chiropractic care at all? The answer may lie in the percentages of those who improve with combined care, which in this study appeared to be substantially more, at least in the first 6 weeks. So the bottom line might be, if care can improve patients' pain and/or disabilities sooner than later, it might be worth combining care initially. The results of this study are limited to the specific use of foot levelers. Future studies should investigate comparisons between foot levelers and other approaches to orthotic use.